It's my honor to welcome to the Bixby Lecture Series, Professor Kari White. She's an associate professor in the Steve Hicks School of Social Work and a faculty research associate at the Population Research Center at the University of Texas in Austin. She received her PhD in sociology with a concentration in demography from the University of Texas at Austin. She got her MPH from Tulane and her MA in Latin American Studies from the University of Arizona. Her research focuses on evaluating the interrelationship between people's reproductive health behaviors and outcomes and the health services and policies that shape their access to care. Her recent projects include the Texas Policy Evaluation Project, which is a collaborative evaluation of legislation affecting family planning funding and abortion restrictions in Texas. So now I'd like to welcome her to begin her lecture, and we will have a time for Q&A at the end.
Great, thank you so much, Paula, and thanks everybody for taking time out of your day to come listen to my talk, which will be focusing on what abortion access looks like in two of the states that have been at the center of legal challenges to people's right to abortion, Mississippi and Texas. And I'll also be talking a little bit about what things may look like in a post-Roe United States now that we have seen at least a sneak preview of where the Supreme Court may be going with their opinion and the recent legal challenge to abortion out of Mississippi. Okay, let's move forward here. So just to provide a little bit of background about where the abortion sits with the US Supreme Court, after about nearly 50 years of upholding the right to abortion, the US Supreme Court seems poised to overturn Roe versus Wade, as we saw in, many people saw in the draft opinion that was leaked just over 2 weeks ago. And this opinion relates to the Dobbs versus Jackson Women's Health Organization case, which the court decided to hear in May 2021, which addresses Mississippi's 15-week ban on abortion. Also in September of 2021, the court refused to block Texas's 6-week abortion ban, Senate Bill 8, from going into effect. That law has been in effect for 9 months. It was signed by the governor a year ago today. And in December 2021, the court ultimately ruled that only narrow legal challenges to the Texas law could proceed, but such challenges have failed in the lower courts. And so that is why we still have SB 8 in place in Texas right now. And just again, a little bit of background. For many people in the US, it is already difficult to get an abortion. Many people already live far from an abortion provider. You can see here on this map, the darker the color, and particularly those darker colors of gray or purple, depending on how it looks on your screen, are places where people live very far from an abortion provider. Those dark purple or gray counties are more than 400 miles away from the nearest abortion providing facility. So people are already having to travel very long distances right now in order to get an abortion. Also, some people are already facing long wait times to get in for either a mandatory consultation visit, if that is required by the state, or to get in for their abortion visit, again, without any current decision from the Supreme Court. So darker colors, again, darker colors of green represent longer wait times. So in some places, people have wait times of over a week. This is taking place in states that have restrictions on abortion, but we're also seeing it in some places that do not have as many restrictions on abortion, like in some places in Oregon, Washington, some parts of California. In some places, just given the way that provider schedules are organized, the number of facilities that are offering care, it can take a long time for some people to get in for an abortion visit. So that's just a little bit of background of kind of what the US looks like right now. We'll return to what the US might look like after the Supreme Court rules at the end of this talk. But first, I'm going to focus in on Mississippi, which is a state where I have been doing research for about 6 years, and looking a little bit at what access looks like for Mississippi residents. So as folks may or may not know, there is only one facility in the state of Mississippi that provides abortion care in the city of Jackson, which is represented by the pink dot there in the kind of center left of the state. And the dotted circle around that is a 50-mile radius. So you can see that most counties in Mississippi are more than a 50-mile one-way driving distance from a facility either in the state of Mississippi or in another state like Alabama, Tennessee, or Louisiana. What complicates access to care even more is that Mississippi has a highly restrictive policy environment related to abortion. The state requires in-person state-directed counseling that includes misinformation about the risks of abortion at least 24 hours before someone can return and have an abortion. The state also restricts the use of telemedicine for the provision of medication abortion, and being able to use telemedicine would be very advantageous in a state like Mississippi where people live quite far from a provider. The state also prohibits insurance from covering abortion care. It requires parental consent from both parents listed on the birth certificate for someone under the age of 18 to obtain an abortion. And the state also has a ban on the use of dilation and evacuation, which is the standard procedure for abortions after about 15 or 16 weeks of pregnancy, amongst other restrictions. What is also complex about the Mississippi context is that it is also a very restrictive setting in the states that surround Mississippi. So there is a 24-hour waiting period in the state of Louisiana, a 48-hour waiting period in Alabama and Tennessee, and a 72-hour waiting period in Arkansas. And all of these states require people to make an in-person visit for state-directed counseling and also an ultrasound before they can return for an abortion. So people are having to drive very long distances and make multiple trips to get their abortion in either Mississippi or one of the surrounding states. So my colleagues and I have done a variety of projects over the last several years looking at access to abortion care in the state. We have conducted several surveys with people seeking abortion at the facility in Jackson. We've also done in-depth interviews with our survey respondents on their experiences accessing care and their experiences with abortion protesters. We've done an analysis of administrative data on Mississippi residents who've obtained abortion care, in-depth interviews with abortion facility staff on parental involvement laws. We've done mystery calls to county courthouses to learn how the judicial bypass process is portrayed to people who are seeking a judicial bypass if they cannot involve a parent in their abortion decision. And we also did a survey of Mississippi residents who were 18 to 45 years old in 2020 to learn about their experiences accessing reproductive health care more broadly and their perceptions around abortion in the state. So I'm going to highlight some of the key findings from this work in the next few minutes. So looking first at our analysis of administrative data from 2018, we obtained data on nearly 4,500 Mississippi resident abortions from facilities in Mississippi, Tennessee, Alabama, and Louisiana. Of those Mississippi residents who obtained abortion care that year, nearly 3/4 of the patients identified as Black. About 2/3 were between ages 18 and 29 years of age. And let me just go back about the racial distribution here. About 73% of people getting abortions in our data set were Black. This is about, in comparison to the population of reproductive age women in the state, they account for just under 50%. Black women account for just under 50% of reproductive age women in the state of Mississippi. So a disproportionately higher share of people getting abortions in Mississippi identify as Black. Just over a third of the Mississippi residents that we obtained data on lived in counties with moderate or high levels of economic deprivation. And 60% obtained their abortion in Mississippi, with the remainder 20% in Tennessee, 15% in Alabama, and just 5% going to Louisiana. What we also found in our analysis is that 17% of people obtained their abortion at 12 weeks from their last menstrual period or later. This is higher than what we see in national studies, where about 13% of people getting abortions obtain care at 12 weeks from their last menstrual period. And so this is really reflective of people potentially having delayed access to care, where care may be more difficult to get and may also be more expensive. And as I said, with the Supreme Court decision, the Supreme Court is considering whether or not Mississippi can ban abortion after 15 weeks. People who are 16 weeks or more accounted for 4% of all of people getting abortion, or all Mississippi residents getting their abortions. We also found in our analysis that people who were getting abortion care at 12 weeks from their last menstrual period were more likely to be under the age of 18, living in moderate or high economic deprivation counties. This is perhaps not a surprise because people who are living in low resource areas may not have a lot of disposable income themselves, and also may have difficulties getting additional financial support for travel and covering the cost of their abortion care from others in their community who are also living on low incomes. We also learned from our data that, perhaps not surprisingly, many people are traveling long distances for care, and longer distances for care were especially common among people who were getting their abortions at 16 weeks from their last menstrual period or later. People who were getting their abortion at this point in pregnancy were traveling twice as far, nearly 150 miles one way, in order to get an abortion. And that is related to the fact that the facility in Jackson only provides care up to 16 weeks. And so many people are needing to travel out of state to another facility in order to get their abortion. But it also just reflects the very limited number of facilities that are providing care in the surrounding states as well. So only 20% of people who obtained their abortion at 16 weeks of pregnancy or later were able to go to their closest facility versus 65% of people who were getting an abortion at an earlier point in pregnancy. And 42% of people who obtained their abortion at 16 weeks of pregnancy or later traveled more than 100 miles beyond their nearest facility to obtain abortion care, versus just 5% of those who were less than 16 weeks of pregnancy. So there's really an incredible travel burden right now for people in Mississippi without the 15-week ban being in place. We also learned from our survey of people getting abortions at the facility in Jackson that they face a lot of other obstacles to care beyond travel. Again, Mississippi has a 24-hour waiting period between a mandatory consultation visit and abortion visit. And we found that most people did not return for their abortion visit the next day. Only 40% of people were able to return within 24 hours, but at least almost 30% of people, or just over 30% of people, had a week or more in between their consultation and abortion visit. So again, this is reflects the fact that people are delaying care for a variety of reasons, some of which we have here, that they have a hard time arranging their work schedule, again, long distance travel, and also a need to arrange childcare. And because they have these multiple arrangements, it can make it difficult for them to return for their abortion within 24 hours. And there are also a lot of financial obstacles to care, again, kind of reflecting the fact that a lot of people are living in very economically disadvantaged communities. In order to pay for their abortion, almost half of the people in our survey had to delay at least one routine expense or sell something of value. So they were delaying regular utility bills, rent and mortgage, postponing buying groceries for their families. 42% of people in our survey also requested financial assistance from other people in their lives in order to be able to cover the cost of care. And more than half of people said that it was somewhat or very difficult for them to pay for their abortion. And when we counted up the various economic and logistical hardships that people encountered trying to get an abortion in Mississippi, we found that the majority, 87% of people in our survey reported at least one economic or logistical hardship getting their abortion, and over a third, 37%, reported 3 or more hardships in order to get their abortion at the clinic in Jackson. As I mentioned before, we also interviewed staff in Mississippi, as well as in several other states in the South, about the parental involvement laws that are required for anybody under the age of 18 getting an abortion. And we found that these laws adversely affect minors' quality of care. The implementation of these laws is far more complicated than just getting a parent to sign on a form. And because of the extra scrutiny that happens around minors' abortions in states like Mississippi, as well as other places in the South, facility staff have to have really undisputable documentation around the parent or legal guardian's relationship to the minor before they can perform an abortion on someone under the age of 18. And so we have a couple of examples here about what the facility staff say. So again, if the parent's ID says Jones and they were Wilson on the birth certificate, which facilities ask for in order to prove the relationship between the minor and the parent, we ask for a marriage, adoption, or divorce decree as to why the name is changed to be sure that they are the same person. Facilities are also asking parents for a form of picture ID and usually also some form of picture ID for the young person. And as we heard from someone else that we interviewed, it's hard for them to come up with even the money to get the IDs because they have to pay for the surgical procedure. They're like, I don't have the extra money to go get an ID made. Sometimes that's a setback for them, and it pushes them to where they might go over the 16 weeks trying to get that paperwork. So again, these types of policies are also putting hardships on facility staff to ensure they're in compliance, on the families that need to make sure that they have all of the paperwork in place, even when they have a supportive, even when they're supportive of their young person's decision, it can be an obstacle to care. States that have parental involvement requirements are also required in prior legal cases related to abortion to allow a judicial bypass where a young person can go in front of a judge who can determine whether or not an abortion is in their best interest or whether or not it is permissible for them to obtain an abortion without their parents' involvement. And the way that people go about this is by filing a petition in the case of Mississippi in the Chancery Court or in family court or juvenile court, depending on how it is operationalized at the state. We conducted, as I said before, a round of mystery calls to facilities or to county courthouses in Mississippi, as well as other states in the South, to learn about how the judicial bypass process was presented to people. And what we found is that a lot of staff, even at the Chancery Court in Mississippi that directly handles these cases, were not always able to provide information to the caller about whether or not judicial bypass was an option or what someone needed to do in order to pursue one. So as we see here, the respondent on the phone said, I'm not sure where you would need to start as far as that. We don't have any paperwork here. We don't even have any judges here right now. You may be able to talk to your OBGYN to see if they have any direction, or I don't know if you've gone to any clinics or anything to see what they suggest, but as far as us right here, you may be able to do it through the courts. I just don't know how to tell you. We also heard some misinformation from the people on the phone, as exemplified in the second quote, someone saying that the person had to file a petition of emancipation before, and then someone would need to go for a judge. So essentially requiring a young person to completely emancipate themselves from their parent before they can get an abortion, which is not what the judicial bypass process is about. With the one facility in Jackson, it gets a lot of attention from anti-abortion protesters, and as do many other abortion facilities. And because of the extent of the disruption of protesters around the clinic, which is located in a frequently trafficked business area, the city of Jackson in September 2019 passed a city ordinance that required all healthcare facilities to have the following protections. So it wasn't just limited to abortion facilities, but all healthcare facilities. They required a 15-foot buffer zone around facilities, an 8-foot bubble zone around patients approaching the facility, and then a 100-foot noise ordinance or quiet zone around the facilities. As soon as a city ordinance was passed, a group who were opposed to abortion posed a legal challenge to try to fight the ordinance from going into effect. And ultimately, the city of Jackson could no longer. You can see here on this from this picture how close protesters are able to get to people going in and out of the clinic. And when we did interviews with people who obtained their abortions at the clinic in Jackson, this is a very scary experience for them. They feel like they are, even when they're in their car, they're not safe. And they feel that the protesters are just incredibly persistent and will not leave them alone, even when they tell them that they do not want any of the materials. And without this ordinance in effect, they don't have any of the protections of keeping the protesters any kind of safe distance away. One of the last pieces I'll highlight from our work in Mississippi comes from a survey that we did in September 2020 through February 2021 of people in the state of Mississippi, people who were assigned female at birth between ages 18 and 45, about their access to reproductive health care and some of their attitudes around abortion. So we recruited over 550 people on social media, living in various counties of the state. And this is what we found. We found that many Mississippi residents do support abortion, but lacked accurate information. So 81% of people in our sample thought that abortion should be legal, and only 45% of people had heard of a recent law passed in Mississippi that related to abortion. But even though people thought abortion should be legal, just over half thought that abortion was actually legal in Mississippi, and 17% of people were not sure if abortion was legal in the state. And only a quarter of people could correctly identify a nearby abortion facility, whether that was in Jackson or whether that was in another state that was closer to them. So people really didn't have a good understanding of the legal context around abortion in Mississippi or where they could even get care, which I think is important for like kind of baseline information, right, around what people's current understanding is of the policy and service environment in the state. And I think this suggests that if the Supreme Court rules to allow states to outright ban abortion, that people in Mississippi are really operating with very limited information about what they can probably do next. We also found that information or lack of information around abortion was more common among people who lived farther away, or to say that differently, people who were living farther from an abortion facility were less likely to think that abortion was legal in the state and were less likely to identify an abortion facility that was closest to them. Okay, so I'm going to switch gears a little bit and switch to some of the work that my colleagues and I have been doing in Texas at the Texas Policy Evaluation Project, and our work specifically as it relates to Texas Senate Bill 8. So just to give a little brief history about abortion laws in Texas, over the last 10 years, in every single legislative session, the Texas state legislature has passed and implemented at least one restriction on abortion. Starting in 2011, the state required an ultrasound to be provided at least 24 hours before someone obtained an abortion, which required people to then make 2 in-person visits to the clinic before they could get their abortion. In 2013, the state passed an omnibus restrictions bill, House Bill 2, that required hospital admitting privileges, compliance with ambulatory surgical center standards, among other restrictions. And this had a devastating impact on the network of facilities providing abortions. In 2015, there were new restrictions that were placed on what pregnant minors needed to do in order to get an abortion. In 2017, there were restrictions on the use of telemedicine for medication abortion, and bans on the use of dilation and evacuation procedures, and a requirement that is not in effect on the burial of fetal remains following abortion. And then I'll just jump ahead to 2021, when the legislature passed Senate Bill 8, a trigger ban that would criminalize abortion if the Supreme Court overturns Roe versus Wade, and additional restrictions on medication abortion. And so we have seen over the last 10 years that the geographic access to abortion has shifted a lot in the state of Texas. So in 2012, before some of these restrictions were put in place, and particularly those that affected abortion providers and abortion facilities, as you can see in this map on the left-hand side, that there were some areas of the state that lacked an abortion providing facility, but there were quite a few facilities in smaller communities like Lubbock, Midland, San Angelo, Waco, and even parts of East Texas. But with the passage, particularly of the admitting privileges requirements, facilities were unable to get privileges for their providers, which do not make abortion any safer, it's important to say. And this had the effect of essentially shutting down a lot of facilities, particularly those in smaller communities. And so you can see in the right-hand side of the map here that there are now vast expanses of Texas, particularly in West Texas and the Texas Panhandle, that have absolutely no abortion providers. And even in the major metropolitan areas where abortion facilities remain, there are fewer abortion facilities now than there were in 2012. So there are currently 22 facilities in the state offering abortion. This is half the number that there were 10 years ago. Oops. Hold on a sec. Okay. Skipping ahead to Senate Bill 8. What is Texas Senate Bill 8? This is a law that prohibits abortion after cardiac motion can be detected, which is usually about 6 weeks from someone's last menstrual period. And it only allows exceptions in the cases of medical emergency. What is unique about this law, which is blatantly unconstitutional because it prohibits abortion before fetal viability, is that it allows almost anyone to sue abortion providers and others who aid and abet a person obtaining an abortion prohibited by SB 8. And the person who files a lawsuit can collect legal fees and at least $10,000 if they prevail in court. So this is not a law that is enforced by the state of Texas or an entity in the state of Texas like the Department of State Health Services or Health and Human Services Commission. It is a law that is enforced by private citizens. It is important to note, though, that the person who obtains an abortion cannot be sued. So just a refresher here on how the menstrual cycle works and why SB 8 is so problematic is that, we start counting the weeks of pregnancy from the date of someone's last menstrual period, right? And so if someone has a typical 4-week or 28-day cycle, this really only gives them about 2 weeks after having a missed period in order to get an abortion. But in Texas, there's also this mandatory 24-hour waiting period, which complicates matters even further. So because of these narrow, when SB 8 was signed into law, we decided to look at what the potential impact of this law might be using some data that we already had from a survey of about 600 people who had obtained abortion care in Texas in 2018. And what we found in that survey is that over half of people were less than 6 weeks at the time that they first contacted the clinic, so they would have been eligible to get an abortion under SB 8. But by the time they went to their ultrasound visit and returned for their abortion, just 16% were still less than 6 weeks of pregnancy. So we were expecting this law to have a very big impact on shutting off access for the vast majority of people seeking abortion care in the state. We also know that there are a lot of people who are not able to get to a clinic early in their pregnancy because they don't recognize their pregnancy until later. So a recent study that Jenna Nobles at the University of Wisconsin did, looking at over 260,000 women who used a menstrual tracking app, and this was about 1.6 million menstrual cycles, found that 22% of women in the sample had irregular cycles or consecutive cycles that differed by 7 or more days, and that these were more common among young women, Hispanic women, and women with conditions such as diabetes or polycystic ovarian syndrome. Also, in an analysis from the Turnaway study led by Dr. Diana Green Foster at the University of California at San Francisco, they found that in the sample of people seeking abortion, people who discovered their pregnancy in the second trimester were less likely to have experienced pregnancy symptoms, they did not have children, or were using hormonal contraception at the time of conception. And so for these people, it is just biologically impossible for them to recognize their pregnancy early enough in order to be able to get in for care under the limitations imposed by SB 8. So if people are able to get care in Texas under SB 8, again, looking back at our map of travel distances, we can see that there are still people in the state who have to travel very far to get an abortion, to get to an abortion facility. So darker colors of blue represent longer travel distances, and people living in central Texas and living in the Texas Panhandle have very long travel distances, even within the state of Texas. If people are not eligible for care in Texas, the majority of the state's 254 counties will need to, people living in those counties will need to travel 200 or more miles one way to get to a facility. And people in most counties will need to travel at least 100 miles one way to get to another abortion facility out of state. So this law is imposing incredible travel distances on people who are not able to get care in the state under SB 8. So some of the ways our team has been looking at the impact of the law has been to document the number of abortions that are taking place in the state, tracking the number of Texans who are getting care out of state. We're doing interviews with people who have been impacted by the law. We're conducting mystery calls to facilities to learn about facility closures and appointment wait times. And we have also done interviews with clinicians about how SB 8 has impacted their clinical practice. And in the interviews that we have done with patients, we have learned that they are just surprised that they are not able to get abortion care in Texas. Because of this 2-visit requirement, some people may show up for a visit. There is no detectable cardiac activity on the ultrasound, and then when they return for another visit, they find out that there is cardiac activity and they are no longer eligible for care. And like this 23-year-old Latina that we interviewed, for whom this happened to, they find that they need to travel very long distances, in this case, a 14-hour drive one way to get to New Mexico, which wouldn't have been possible for them without the assistance from an abortion fund. Other people, like this 41-year-old white woman who from Southeast Texas, who ultimately traveled to Louisiana, didn't realize she was this far along in her pregnancy as she was, reflecting some of the things I talked about earlier. She wasn't necessarily having very obvious signs of pregnancy that she felt like she should have had. And so she knew that she was still early in pregnancy, but she didn't think that she was, over 8 weeks from her last menstrual period. And so was very surprised to learn out that she was not eligible for care in Texas and now had to go out of state. So when the law went into effect, we were able to look at how abortion has changed and how the number of abortions have changed in the state following implementation of the law. And we found that in the first month that SB 8 was in effect, the number of abortions decreased by 50% compared to the same month the prior year. This certainly wasn't as much of a decrease as we had anticipated, although certainly it is a bigger decrease than we have seen before when Texas has passed other restrictions on abortion, including the closure of half the facilities in the state, or during the onset of the coronavirus pandemic, when the state prohibited most abortions for a period of 30 days. This 50% decrease is bigger than anything we have seen before, so it is still sizable, but it is not as big as what we had anticipated. And we think that this is the case for a variety of reasons. One, that because there were several months between the law being signed and the law going into effect, this allowed clinics to develop procedures and protocols that would help them see as many patients as possible in order to get them in if they were still eligible for care. Patients were also, if they knew they weren't eligible for care or disclosed to the clinic how far along in their pregnancy they were at the time of calling to make an appointment, they were turned away at the phone call. And so this meant that clinics had to see fewer patients overall, which again would allow them to get patients in for that ultrasound and abortion visit in a more timely manner. Patients were prioritizing returning for their abortion visit over other responsibilities, but also we think a key factor is that there was an incredible amount of funding that was coming into Texas clinics, as well as abortion funds that were helping to offset the costs, the out-of-pocket costs of paying for the procedure, because like Mississippi, Texas also prohibits the use of insurance for abortion care, and having to come up with the out-of-pocket costs is a significant cause for delay. And so with this additional funding assistance being available to help people pay for care, we think this has really allowed as many people as eligible to be able to get care in Texas, which wasn't necessarily what we were expecting. But certainly there are hundreds and thousands of people who are not eligible for care in Texas. And so many of those people have traveled out of state for care. We have obtained data from facilities in 7 states, Colorado, Arkansas, Kansas, Oklahoma, Mississippi, Louisiana, and New Mexico. And from the data we have obtained from those facilities, we saw in the first 4 months that SB 8 was in effect, that about 1,400 Texans were traveling out of state each month to get an abortion. Almost half of those were going to Oklahoma, where just 4 facilities are providing abortion care. And now Oklahoma has passed additional restrictions that are very similar to Senate Bill 8, so making it essentially impossible for Texans to obtain abortion care in Oklahoma, in addition for people in Oklahoma to obtain that care. And about a quarter of people are going to New Mexico in order to get their abortion, but certainly people are traveling much farther than that. And even though we have seen a very large number of people traveling out of state for care, this is coming at incredible costs for people. It is creating an immense amount of economic strain. Similar to what we saw in Mississippi, people are falling behind on their bills because they're having to use the money that they would pay for their internet, their car insurance, in order to cover the cost of travel and their abortion. They can't get their insurance to cover it out of state. They're not able to buy food for their families, and they are just trying to find whatever money they can, change around the house, those extra dollar bills in your pants pockets, in order to be able to come up with money to pay for the care that they need and are no longer able to get in Texas. Through some other research that a colleague of mine, Dr. Abigail Aiken at the University of Texas at Austin has done, we also know that a lot of people are looking for abortion pills online. She has done an analysis of aid access, which mails medication abortion pills to people in the US as well as in other settings. And they saw a huge increase in online requests for medication abortion pills when SB 8 was being debated in the legislature, as well as when the law was enacted in early September. And requests have remained high after SB 8 has been in effect. Through our interviews with clinicians, as well as people who are experiencing complications in their pregnancy, we are hearing that clinicians do not think that they can provide referrals to out-of-state abortion care, let alone treatment for people who are experiencing things like ectopic pregnancies, miscarriage, anomalies, fetal anomalies, or serious pregnancy complications. And pregnant people, as you can see here in this quote, who are in these circumstances feel abandoned by their providers. They don't feel like they're getting any medical guidance. And at a time when they're already getting very shocking news about what is happening with their pregnancy, they also feel that they are being left on their own to figure out what they are going to have to do. And even though someone technically cannot be sued for getting an abortion or having an abortion that is in violation of SB 8, in early April of this year, a 26-year-old woman from South Texas was charged with murder for a self-induced abortion after presenting for care in an emergency department. She was ultimately released and the charges were dropped. But this has clearly sent shockwaves through the community about what may happen in the future. And some folks on our team have been having fun, I guess you could say, in dark circumstances, taking some of the information from the in-depth interviews that we have done with people about how they feel about the Texas law, and similar to some of the recent polls that have come out, even in the news today, that people are not supportive of laws like SB 8. It is making things harder. It is unbelievable. It is ridiculous. It is unfair. It is cruel. It is not right. It doesn't make any sense. People are not supportive of these policies in Texas, and it is making care extremely difficult for them. So with the draft Supreme Court opinion being leaked, it is likely that the US will no longer have the protections of Roe versus Wade in effect. And so what might this mean in the very near future? So there have been some really great graphic journalism that has been out there in the last few weeks. This, I believe, is from the New York Times. And it is expected that, at least about 26 states, depending on how you want to count, are likely to outright ban abortion, or they have other restrictions in place. And those are the states here that are in orange or yellow. And so you can see that there are going to be essentially the entire US South, parts of the Midwest, and parts of the Western United States where people will not have access to abortion services. So this is the map that we saw at the beginning of the talk, what travel distance for abortion care looks like. This is what it's going to look like after Roe v. Wade is overturned, where just huge areas of the US South are going to be at least 400 miles away from the nearest abortion providing facility. This will also be true in Arizona, in Utah, and in the upper mountain states. Certainly and this is going to affect an enormous number of reproductive aged women, a term that I'm using because this is the data from the American Community Survey, which still goes with the gender binary. And the largest share of folks are going to be in Texas, followed by Florida, Ohio, and Georgia. A smaller number of people will, because Mississippi has a smaller population, they account for a smaller number of folks who will be affected, but there are going to be millions of reproductive age women who are going to be affected by this ban. And the law is also going to have disproportionate effects by race and ethnicity. Similar to what we saw earlier in my presentation, most of the people who are going to be affected in Mississippi, as well as Georgia, Alabama, North Carolina, Tennessee, are people who identify as Black. In states like Texas, in states like Arizona, in states like Florida. It is going to disproportionately affect not only Black women, but also Latina women. So this is really going to exacerbate any existing disparities that we already have by race and ethnicity. So there are very few states currently that criminalize people for self-managing their abortion. Those are states here that are highlighted in purple. Some of these, of course, are also states that are likely to ban abortion if the Supreme Court overturns Roe versus Wade. But there are states that have already used other laws on the books to arrest people who are suspected of self-managing their abortion. Texas being one. This was before the Lisel Herrera case in April, California also being another. And so I think we need to be really mindful of how some of these existing laws that are out there can potentially be used to criminalize people's pregnancies and pregnancy outcomes. So I'll just conclude here and say that we've seen from our work in Texas, in Mississippi, and other states, as well as what we know from global contexts, that abortion restrictions have not reduced pregnant people's need for abortion care, but they have reduced access to in-state services and imposed incredible burdens on people who are able to travel out of state. And in a post-Roe US, abortion is going to be criminalized when these trigger bans go into effect in many states. And this is going to have a chilling effect on care under the very narrow exemptions under which abortion is allowed. And this is going to put pregnant people and clinicians in more precarious positions and strain services in states where access remains. And so as I've been talking with people about, the Texas context or what's been happening in Mississippi, or just lecturing in my class about women's health policy, I'm often asked about, what gives me hope, or where do I go for inspiration? And I don't necessarily have a happy note to end this on, but how I will end this is just to say that we need to get motivated and we need to get creative in order to be able to make sure that people who will still need abortion after these types of restrictions go in effect, as many of them are able to get care as possible. So thank you so much for joining. This is where you can reach me. You can find some information about our work, and I will end it here and take any questions that folks may have.
Great, thank you so much. It was an excellent talk. So let's open it up for any questions, comments, and just use the raise your hand feature.
Yes, Natalia, I think.
Mm-hmm. Yes, thank you, Dr. White. That was a wonderful presentation. So in one of your slides and in your presentation, you and in your research, you mentioned that you were studying how women were traveling to other states. In some of the work that we have been doing, in particular with feminist organizations in Mexico, they have been noticing how a lot of women from Texas have been traveling to Mexico, and how feminist groups have been supporting and helping through acompañamiento a lot of, well, not a lot, but women who have been trying to access abortion now in Mexico. And I'm wondering if that has come up in your study, and if women are talking about that in particular in Texas.
Yeah, that is such a great question. I'm so glad you mentioned that, because I certainly did not. We have not really dived into that at this time in our work. We know from some of our prior research that people are even, before Mexico had any significant changes to its abortion laws, that people were traveling to Mexico to get misoprostol and medications to have an abortion, over the counter at pharmacies or through their social networks. So we knew that this practice was already taking place. Our research has not currently focused on, whether or not those practices have, how those practices have increased or changed, but we have certainly heard, similar to what you have shared, that, there are these feminist groups that are helping people get the medications, either by traveling to Mexico or getting those medications into the United States. We have some work that we're going to be starting over the summer, looking at access to reproductive health care more broadly in some of the border communities in Texas. And this is one of the areas that, we're interested in learning more about. But yeah, it would be great to, potentially connect later and hear about some of your work.
Thank you. I have a quick question. I was just wondering, years ago when EC, emergency contraception, was illegal or not available without a prescription, there was some discussion about advanced prescriptions. In other words, that people would get some EC, and anyone who could get pregnant and just keep it in the closet in case of need. And so since they weren't pregnant at the time, it kind of got around some of these restrictions. So I was just wondering, is anyone talking about that vis-a-vis abortion medication? Because if you're not pregnant at the time that you had obtained these medications, then you couldn't be said, it wouldn't then be a criminal activity just to obtain this medication. I'm just wondering what your thoughts are on that.
My understanding widely that is known, but I know that medications can be provided to people who are not currently pregnant but who may need them, or think that they might need them down the road. What share of the medications they ship are advanced provision versus for people who are currently pregnant and seeking to not be, I don't know, and I'm not sure how the other how the other places that ship medication abortion pills are operating in that regard, or what the legalities are. But I know Lara Semple had her hand raised at one point, so she might want to chime in there about legality or ask a question.
Oh yeah, I actually had a question. I don't know the answer to Paula's excellent question, but my question builds on hers and also a little bit on Natalia's. I was also wondering about Mexico, and in general, just trying to get a sense on what else is it that women are going to do, or pregnant people going to do. So again, the slide with the arrows going to the other states. So for the people who can't do that, or who do something else for whatever reason, is anybody studying, what percent of people are carrying to term? What percent of people are like just Googling dangerous, doing things that are dangerous, or having, or just thwarting the law, having, a cousin from another state send something in rather than going through telemedicine. Do we have a sense of what the outlets are? So that was one question, if anybody's looking at that. And my other small question is, what can you tell me about the California arrest for someone self-managing an abortion? Because I don't know about that. I tried to Google it at the end of your talk and I couldn't find it. I think a lot of us on this call are now in the mode of, what is California going to do? Because we do have a progressive state that is angry about what's happening, or what seems about to happen at the court. And there's just a lot of discussion about how can we be leaders and create even more progressive laws designed to kind of counter or mitigate what's happening nationally. And certainly we wouldn't want to address that. I don't know if it was just a fluke or anything you could say about that.
Yeah, I think there are probably more details about that in the If When How report, where I pulled that map from, and certainly the folks there can probably provide, if there aren't details in that report about what the circumstances were for the case or cases, they probably would be able to advise on what mechanisms were used in those circumstances. To your question about the other ways that people are, potentially going to be able to try to end their pregnancies, beyond getting, medications from Aid Access or these other online sources, or getting medications from Mexico. We have, through some other work that we have been doing around people searching for abortion, we know, and also some of our prior work on people who have tried to self-manage abortions in Texas, we know that people are looking up things online. Some of them, vitamin C, high doses of vitamin C seem to be incredibly popular search results. It certainly is not effective at ending a pregnancy, but people are also trying other medications. We have also heard from some of our work of somebody doing a telehealth visit and having the medications mailed to a sister or cousin in another state, like you said, and then the medications, that person then sending the medications to them, or they get a PO box someplace else and have that mail forwarded to them. So people are getting creative around trying to find other ways to get medications through other mechanisms. So, I think that there will be just a diversity of ways that people are going to be exploring how to end their pregnancies if they can't get clinic-based care or don't feel like they can trust, some of these online sources.
Thanks.
So I think we have time for maybe one last question, if there is one.
Yeah, I can ask one. And sorry if you hear the echo. I'm with Kari White right now in the same office, but kind of piggybacking off of Laura Stempel's question, since people may have to travel like more than 100 miles one way to a facility that is out of state, and for states like Mississippi that live in the middle of anti-abortion hubs like Louisiana, Alabama, Tennessee, and Arkansas, that have incredibly restrictive policies, how difficult can it be for these women, to access abortion? I know you had stated like they'll have to travel even longer distances with post-Roe, but do you see that there would be an increase in like adoption as an option? Can you talk a little bit more about that?
No, that's a great question. I think some of the best evidence around that comes from the Turnaway study. They did ask some questions of people in that study if they, were not able to get their abortion, what they were thinking about doing. And adoption was just not really something that people were considering. And I think, kind of the way that study team describes it is people are considering, parenting or abortion or parenting and adoption. It's not that they're usually considering abortion and adoption. And there's some, I think, other great work that Gretchen Sisson at University of California at San Francisco has done around, kind of how people are thinking about adoption and adoption as an option for them. That I think that certainly that is being put forward as, the solution for people who are, do not want to stay pregnant and parent. And, it just doesn't seem to be really like what people are considering. They know that they cannot afford another child. There are a lot of emotional and psychological stresses associated with carrying a pregnancy to term and then placing that child for adoption. Yes, and as indicated in the chat, there are a lot of we see a lot of problems with the adoption system and foster care placements for infants and children who, for Black and brown babies. And, this just isn't really a system that is really addressing this issue. And it's not really an option that people are considering.
Well, on that sad note, but I do love your notion. We've got to get motivated. We've got to get creative. I thank everyone here, and I know we've lost about half of our audience because they've had to dash to class or other things, but we're really grateful for this inspiring talk. And I think now we all have to go back and think about what we can each do. So just a quick round of applause for our speaker.
Yeah, thanks so much for having me.
We're delighted. Thank you so much.